Hello, everyone. Thank you all for joining us today. It's good to see some names and faces I recognize and some new ones. I really appreciate you joining us. My name is Greg Belville. For those of you who I have not met, I am the Executive Director of Prevent Child Abuse Iowa. So today we're talking about our 2021 legislative agenda. As Laura said, we are recording this, so if people by chance don't get a chance to attend or want to go back and listen, we'll make that available after the presentation. Just to go through a quick overview of our time today, I'm going to take about the first 20 minutes and talk about what Prevent Child Abuse Iowa's priorities are. And then we have Mary Gannon, a board member of Prevent Child Abuse Iowa. She has over 20 years of experience in various capacities working with the Iowa legislator, both as a lobbyist, as a staff, and in her current role at the Iowa Public Employee Relations Board. So she's here today to do sort of a quick advocacy best practices, as well as she's been gracious enough to make herself available for any advocacy questions that you folks might have as you're preparing in whatever capacity you're preparing for to do your advocacy work. And then we've also allotted some time at the end for people on the call to share with the group some of the priorities that they have and things that they'll be working on this legislative session. So again, I'm really grateful for joining us today and your support of Prevent Child Abuse Iowa and the work that all you folks are doing to help support kiddos and families in our state. I also want to say thank you to Laura. Laura manages our community adolescent pregnancy prevention program. She's also graciously helping with manage the chat room and the tech support today. So thank you very much, Laura, for that. We will have a couple of resources available at the end of the presentation as well. We'll work on getting those put up on our website. And if there's anything that you see today that you would like access to, please feel free to email us after this and we'll work to make sure that you get what you need. And happy Friday and happy New Year. I hope everybody's having a good start to their new year. So our first priority that I want to talk about today is our sexual abuse prevention priority. This was one of our main focuses last year. This has been a priority for Prevent Child Abuse Iowa for a number of years now. And what we really are looking for from the legislator with this priority is a focus on adult-focused child sexual abuse prevention. So this has been, from my understanding, an issue that's been through the Iowa legislature for a number of years now and has not successfully gone through. And what we're really asking the legislature for is to have a requirement of training of teachers and staff at Iowa's public schools for adult child sexual abuse prevention. We're also asking for age-appropriate child sexual abuse prevention be provided to the students at those schools in pre-K through 12, and that resources be readily available for parents and caregivers of those students for information on child sexual abuse prevention and referral resources necessary should they suspect any child sexual abuse. It's different from sort of the recognition and mandatory reporting. What we really are looking for is those recognizing behaviors, what to do, how to make sure this doesn't happen, and to really keep the responsibility of keeping children safe out of the hands of children. We want that responsibility to be in adults. We want kids to have that information and be able to recognize healthy boundaries, appropriate and inappropriate behaviors, make sure that they're not perpetrating against other children. So we want children to have that information, but we want the primary responsibility for keeping kids safe in the hands of adults. We had some level of success with this last year. This was introduced in the House in the Public Safety Committee, and it made it through that committee into the House floor. Unfortunately, when the legislator went home when the pandemic hit, progress stopped on that bill there. We have Representative Moore introduced that bill last year, and we've had some conversations with him already this year, and he is interested in reintroducing that bill and continuing that work. So we're really excited about that. And we know that there's some other groups that are interested in and working to advance this priority as well. So this will be one that we're working really hard to get passed this year. The next priority we have is funding for the Children's Mental Health Network. And what we're looking for here is adequate, sustainable, and predictable funding for mental health services across the lifespan. And there's a number of other groups around the state that we are a part of and coalitions, the iOasis 360 Coalition, CAMI for Kids, that they're all working together, and I'm sure more, all working together to help ensure this happens. There was some funding put in the budget last year by the governor, but what we're looking for is that continued adequate, sustainable, predictable funding for the mental health network across the lifespan, including kids and adults. And we would really like that funding to be able to cover the recommendations and implement the recommendations put forward by the Children's Mental Health Board. We've so far heard that this is a big priority for a lot of people, that this is something that the governor is interested in doing. So we're really hopeful to continue to move that forward this year as well. Next, we are looking at support for families, and there's a couple of different areas that we have here. Again, some of these will look familiar. The first of which is the expansion of First Five to all 99 counties. There's currently 11 counties that do not have First Five. And what First Five is a public-private partnership that really focuses on working with providers and making sure that they can connect those providers and the children ages 0 to 5 that they're working with appropriate resources so that they can ensure effective and strong social emotional development in those first 5 years. So there's currently, like I said, 11 counties that do not have this. Leon, Sioux, Plymouth, Cherokee, Woodbury, Ida, Jackson, Clinton, Iowa, and Johnson counties all currently do not have First Five. The rest of the 88 do. So we've already begun speaking with some legislators. We spoke with Senator Wall about this already, and it's something that he acknowledged and is interested in continuing to push forward. The next thing that we're working on here is an increase in access to childcare assistance. So there's been a lot of talk over the past couple years about working to eliminate the cliff effect, and there was some progress with that last year in increasing access or increasing the cap on the cliff effect from 145% to 185%. That change was made in administrative rules last year. What we're talking about and hoping for this year is to increase access on the front end of that to 185. So the way it's currently set up, you have to drop below 145% of federal poverty level to qualify for child care assistance, and then you can retain it up to 185. What we would really like to see is access. If we need it at 185 on the back end, we should be able to qualify for it on the front end, we believe. So to increase people's ability to access that at that 185% of federal poverty level is our ask there. And the last thing in this is increase in earned income tax credits for low and medium income families. We've talked with some legislatures already about this, and it sounds like there's a couple of different ideas out there about ways to effectively do this and cost-effective ways, looking at getting the most help to the most people. So we're really interested in helping families, especially in light of everything that's gone on this year with the pandemic and employment and the derecho and just different difficult things that families are facing, that we can help provide them in this way with the resources that they need to help reduce some of those stressors and increase some of those concrete supports by helping them maintain the most of their income as possible to meet their family's needs. The last priority area that we have is support for the child welfare network. And there's, again, a couple of different asks in here. The first is increase in funding for primary prevention efforts across the state. We really want to be as upstream as possible and working, and we appreciate all the work that's being done in prevention to make sure that a call to child welfare does not ever need to happen. So that's our first ask there. The second ask there is that the legislature ensures that the Department of Human Services has the necessary funds available to meet their goals that have been laid out in a couple of different ombudsman's reports, to help improve and make that system as effective as it can be for the children and families that it serves. So really looking there to ensure that they have the necessary resources to maintain appropriate staffing levels, to be attractive recruitment and opportunity to attract qualified people, make sure that they have a diversified workforce, to make sure that they have the resources that they need to appropriately train and retain staff and operate at effective caseloads. The next ask that we have there for the legislature is to ensure that the Department of Human Services has the necessary resources it needs to make improvements to its data management system. In the reports, the ombudsman's and the reports after the child death review reports after the unfortunate deaths of Natalie Finn and Sabrina Ray, that was one of the things that was identified, was we have make sure that those child welfare employees have timely and effective access to all of the information that they need to make accurate determinations of a course of action. So those are all of our main priorities for this year. As always, we keep an eye out for different bills and different pieces of legislation that are out there related to supporting children and families, and try to support those ones that we think are a good fit and would be a good help. So we appreciate all of your support and helping to move these things forward and reaching out to your legislators and your representatives in your area to help support these efforts.